a bit of time before we live stream the meeting. I think somebody is moving around there, so I'm gonna go live right now. Okay. Good evening, and good evening, good day, good morning, wherever you're listening to us right now. My name is Anfumi Fatusain. I'm the convener and founder of Renewing the African Mindset. Renewing the African Mindset, otherwise known as RAM, is a non-profit making organization focused on topical issues which are hardly discussed in the open due to the mindset and due to the cultural beliefs which we have as Africans, traditional values. At times it's due to ignorance. And then you have the culture of silence, whereby a lot of people don't say anything. And consequently, they actually suffer. For example, today we're talking about COVID-19, which is actually a global issue. Some people would rather keep quiet because of the taboo attached to the fact that having COVID-19 is not only a disease, the way some people perceive it, but at the same time, is not something to openly talk about. So today we want to demystify some of the myths surrounding COVID-19. Also, we would also like to inform people about the vaccine, which most Black people do not want to take. And that's because some people have concerns about it, whether it's a way of depopulating the Black race. And some people believe it has a spiritual connotation to it. So today we're going to address all these issues. And hopefully we'll be able to convince people to go for the vaccine. And if they still have further reservations about it, we have medical experts here today to inform us about COVID-19 and how serious it is. Because a lot of people don't even think it's that serious, because people have an idea, especially in some parts of Africa, that it will never ever occur in Africa, that it doesn't occur in hot climate. However, the death rates have been increasing all the time due to this misinformed notion that COVID-19 is just specific to cold climate. So to start us with the conversation this evening, I will call on a lady. She is actually a preventive medicine physician who is board certified in the medical specialty and has been a fellow of the American College of Preventive Medicine for several decades. Currently, she's the director of the Public Health and Preventive Medicine residency program at Morehouse School Medicine, and she's also the professor in the Department of Community Health and Preventive Medicine. This lady is retired as captain from the US Public Health Service and the Centers for Disease Control and Prevention in 2017 after spending more than 30 years of service in preventing and controlling infectious diseases through vaccination, directing public health emergency preparedness for and response of the most vulnerable populations in the society and advancing health equity. During CDC service, which is control and can you hear me there? Good. Please join me in welcoming Dr. Sonia Hutchins AK. Dr. Sonia, welcome. Dr. Sonia is actually based in Atlanta, Georgia.
Well, good evening to my colleagues in Europe and Africa, and good afternoon to my colleagues in the United States on Eastern Time. It's indeed a pleasure to be with you all here, and wanted to say that I got some of my education in Nigeria at the University of Ibadan when I was in medical school. I spent several months, and I say a quarter of a year, actually, doing a social medicine rotation. So I also was trained in Nigeria, so I want to mention that piece. But at any rate, I'm here and more than happy to answer any questions.
Okay.
So what are the questions that you have for me at this time?
Let's start from the basics. Could you tell us what's a virus?
Okay. Well, a virus is a living thing. Okay. So we have to remember that it's a living thing. And this living thing is so small, we can't see it with our naked eye. We can't even see it with a light microscope, a regular light microscope. You have to use a high powered electron microscope. That's how small it is. Right. So, yeah, but it's living. And it has some genetic material that we have, right? And to protect that genetic material, they have a protein coat. It's a very simple living thing. Right. The thing that we need to know about viruses, they want to replicate themselves. They want to reproduce, but they cannot reproduce on their own. They have to get into a human cell or an animal cell to reproduce. So you have this living thing that's trying to get into your cells to reproduce, to survive. Okay. All right, so we just have to understand that at the very beginning.
Right. Okay, thank you for that. Somebody just said to me that they missed out a bit on your biography. Maybe I should just quickly do a recap. Dr. Sonia Hutchins is a preventive medicine physician who is board certified in the medical specialty and has been a fellow of the American College of Preventive Medicine for several decades. Currently, she's the director of the Public Health and Preventive Medicine residency program at Morehouse School of Medicine and professor in the Department of Community Health and Preventive Medicine. Dr. Hutchins is retired. She retired as a captain from the U.S. Public Health Service and the Center for Disease Control and Prevention, otherwise known as CDC, in 2017, after more than 30 years of service in preventing and controlling infectious diseases through vaccination, directing public health emergency preparedness for and response of the most vulnerable populations in the society, and advancing health equity. During her CDC service, she also held several leadership positions, received numerous honor and service awards, including Outstanding Service Medal, and authored approximately 90 peer-reviewed publications. Thank you so much for that, Dr. Sawyer. Could you just let me know now, or inform us, what exactly is COVID-19? Is it a disease? Is it a condition? Is it a virus?
Okay, well, COVID-19 is the disease that the virus causes by replicating in our cells. Okay, right. So we have to understand that this is a living thing. It gets into our cells and it causes havoc. Right. All right. Okay. And some of that havoc is caused, and some of the symptoms are caused because we do mount a immune response to the organism. We don't just allow foreign bodies to get into our body. We have a protective mechanism, which is our immune response. Mm-hmm. It consists of cells, and those cells, some of the cells produce proteins to attack the foreign object. And in this case, it's a virus. So these proteins or antibodies attach to the virus and neutralize it, while some of our other cells are gobbling it up to kill it as well. Right. So we have a miraculous immune response to foreign objects that try to get into our body and live there.
All right. How is COVID-19 transmitted?
Again, COVID-19, the virus. Okay, so when we say COVID-19, we mean the disease, right, that the virus causes. Mm-hmm. And when we say SARS, coronavirus 2, that is the name of the virus that causes the disease COVID-19. Okay, all right. And again, COVID-19 is the illness and the disease, all the symptoms that you get. So I'll talk a little bit about what happens. Some of it is because of our immune response, and some is because our cells are dying, and those cells that are infected by the virus.
Okay.
Now, some of the symptoms that are typical. Oh, you asked about the transmission.
Because we
Okay.
don't use
Yes. Yes. So let me go
substitute.
back to the transmission.
Yes. Okay.
Because I think that it's sort of implied. If this virus needs to get into our cells to replicate, it tries to find us. So it's transmitted from one person to the next through sneezing and coughing. But also, you may not have any symptoms. We've learned that, you don't have to be sneezing and coughing. The virus is there in your nose or in your mouth, and you're talking to someone. And that virus comes out and is transmitted to that person that way. So we describe that as person-to-person transmission through the respiratory route. So you'll hear those terms. So the virus is transmitted from person to person through the respiratory route, through talking, sneezing, coughing, typically. So it's very easy for that to happen when you're in contact with other people.
Okay. We've had expressions like, or words like asymptomatic person. What exactly?
Asymptomatic person means that they don't have any clinical symptoms. And when we say clinical symptoms, we're talking about coughing, sneezing. Usually you don't think that when someone talks to you that the virus can be transmitted. But this virus is so communicable, even talking to people, you could be infected. So that's what we mean by asymptomatic. If somebody's just talking to you, casually, not coughing or sneezing, then that's asymptomatic transmission.
Right.
Symptomatic transmission is if you're coughing and sneezing, we know you're ill.
That's right. So if, say, for example, if I were asymptomatic and I kept on walking around, attending social engagements, parties, going to church, would I know that I'm asymptomatic?
Yeah, if you don't have any symptoms, like you're not feverish, you don't have any chills, you are not coughing and sneezing, you're not short of breath, you don't feel weak or tired, yes, you may be asymptomatic, and you may not even know that you're carrying the virus unless you get tested.
Right.
And tests are pretty widely available, particularly here in the United States. Right. So if you want to get tested, because let's say you're going to see your an older friend or an older relative who could develop severe illness,
right?
You might want to get tested to know that as well.
Okay. Now, you talked about the old people, and we have an expression here. I'm not sure whether it's a WHO expression, and it's like family bubble. Would you have yeah, I don't know whether you have the same thing in the United States.
We don't necessarily call it a family bubble, but we call it people who live with you in your household.
Right.
And you could consider that like a little bubble. Right. Particularly if you're all staying home and you're not going out when there's a lot of disease that's being transmitted. Right. There's a lot of disease in our communities, right. And people are they don't know they have it, but there are some people who do know they have it. Right. And if you're not wearing a mask, so let's talk about, and I know that other people are going to talk about it, but I want to put this in context. If you have this virus that is transmitted through talking to each other, right?
Yeah.
Wearing a mask can block that, but you have to wear the mask over both your nose and your mouth. Okay, so be very clear about that. Just, wearing the mask over your mouth is not going to be enough. You have to cover your nose and your mouth to prevent that spread to somebody else.
Okay, let me create a scenario. I walk across the road to go and visit an aunt. She's my aunt anyway. Why do I want to cover my face? Why should I cover my face or my nose? Why should I use a face mask?
Well, I'm assuming that your aunt is an older adult, and that she, in fact, could develop really, really severe COVID-19 disease
Right.
if exposed to it. It's very clear. We know now that older people have serious illness and they could be hospitalized and even pass away. So we have to be very careful. Even if you don't have any symptoms and you're just going to talk to your aunt,
Right.
you might be responsible for transmitting that virus to her and her getting sick and hospitalized and passing away. And we've seen that. So you have to be careful. When we talk about people in the home bubble, typically, if you're staying home a lot, it's probably okay. But there's a lot of disease in the community. There may be more than 10% of the population that might be carrying the virus at any point in time, particularly here in the US, throughout our states. And what that means is 1 out of 10 people could be carrying the virus at any point in time.
Yeah. So say, for example, myself and Dr. Toyin, we're friends. I know her very well. She lives across the road and we go to parties a lot. So it's fine. She's my
Well,
girl.
Again, if there's a lot of disease in the community, more than 1 out of 10 people, it might be 1 out of 8 people to be carrying the virus. And one of the things you have to be careful when there's that much transmission in the community or spread from person to person in the community, you have to be very careful. That's why one of the public health recommendations is for us to stay home and not go out, do not gather in large groups unless we absolutely have to. When we have to go to the pharmacy, or if we have to go to the grocery store to get our food, yes, those are times when we go out. But when we go out, we have to wear our mask. Okay, we're protecting ourselves, but we're also protecting others in the community from us as well. So it's
how long can I have the face mask on?
As long as you're out in public, you should have that face mask on. And if you're at home, let's say you have to work in a grocery store, for example, every single day. You're there working and you have to come home, but you know that your grandmother is there or a older aunt is there. You do not want to transmit that virus to either of them. So what you have to do, and then maybe other people in your home. So what you should do is continue to wear your mask if you're not able to isolate yourself from the other members of your family.
The reason why I'm asking these questions, I mean, I would ask layperson's questions, even though one knows exactly what one should be doing, because you just need to go on Facebook and you see worship centers, no 2 meters. Well, I don't call it social distancing. I call it physical distancing, because a lot of people think, well, because I know her, he knows me, and that kind of a thing, we know each other. So we don't have to be 2 meters apart. And you see people, they don't even care. It's like, well, there's no point in covering, the face. There's no point in using the face mask. So here's the reason why I'm asking these questions. They could sound repetitive, but it's just to reinforce it in people's minds that it is very important for us to wear face masks. If I were to go to a party and there are about 500 people there, I can't see myself wearing a face mask for 1 hour. I want to have a drink. I want to eat. And then I see another friend, we hug each other. And then another person, there is handshake going all over the place. What do you think is going on there?
Are you asking me or the audience? Because there is transmission. There is spread of the virus between people. If you have 500 people at an event, and they're not, 2 meters or 6 feet apart, you're going to get transmission, particularly if 1 out of 10 of them are infected with the virus.
So with the virus, I think it only, you could only get it in cold climate, isn't it?
No, that's not true.
That's the perception of a lot of people. It doesn't happen in Africa.
It does happen in Africa. There are cases in Africa. And for people who want to know where the virus is occurring now, a good source is the Johns Hopkins website. And all you do is, you go to Google, type in Johns Hopkins, COVID-19, and up will come the map, and you'll see how pervasive, because this is a worldwide epidemic or a pandemic.
That's right.
And we're all in it together.
Why is the second wave much more severe than the first?
Well, because there's more disease circulating. When the virus first emerged, okay, it spread from China, to other countries, and then it kept going, because what happens if you have a virus that infects one person, then that person can affect other people, and there's an exponential growth. That's what we call. When we think about how communicable this virus is, it is more communicable than the flu virus. And we know how communicable flu is. And it is, the UK variant, for example, is approaching the communicability of measles. And measles is extremely infectious. So you have to think about this virus is extremely infectious, much more than the flu. And that you are going to get it if you are not immune to it. You will get this virus.
What's the impact of COVID-19 on one's health?
On one's health?
On your health. What's
the impact? Yeah. Again, we going back to the cells that are destroyed in our body because of the virus. And some of the symptoms include, in addition to being ill and feeling weak and tired because some of your cells are dying, you also can get muscle or body aches, because the virus comes in through the nose and the mouth, and it spreads throughout the body. And some of the symptoms include fever. That's why people feel feverish. You get chills. Some of the symptoms are similar to the flu, but there's some others that are not typically seen with the flu. I mentioned the fever, the chills, the cough, the weakness, the body aches, but you also get a headache. You can get short of breath. And when you start getting short of breath, you got to be very, very careful, because that can lead to infection of your lungs. And that's why people are going to the hospital, because they're short of breath. They can't get the oxygen. The viruses have gotten into the lungs.
Right.
Okay. And they're killing those cells.
Right.
So people in the hospital are supported with oxygen. So they get enough oxygen. You need oxygen to survive, to live. And so you go to the hospital, you get the oxygen. Some people still are not able to get enough oxygen, and they have to put them on what they call a ventilator, a machine, to help them breathe, so they can get enough oxygen. Now, getting back to some of the more common symptoms that are less severe, one of the symptoms is the loss of taste or smell. All right, the virus is killing your cells in your nose and your mouth, and so that's in your taste buds. So that's what's happening there. Another symptom is, a runny nose or nose congestion, just like the flu. But the other thing is your cells in your GI tract, like your stomach and your small intestines and large intestines, everything in your GI tract, the cells are dying too. So you get nausea and vomiting, and also soft stools or watery stools as well. Mm-hmm. So you can get a whole host of symptoms. A lot of symptoms are consistent with the flu, but some of them, like not being able to taste or smell, are unique to this virus. And there's more cases of nausea and vomiting and diarrhea than what you see with the flu.
Okay. Would you say COVID-19 is Well, we talk about the fatality. How come some people survive and others don't?
Well, one reason is because of their underlying health conditions.
Mhm.
If you have some chronic conditions like diabetes, high blood pressure, um, asthma, those individuals may have more severe disease, particularly if their diabetes and high blood pressure and asthma are not controlled well on medications. So you have to be very, very careful if you have those conditions. And we know a lot of people in our community have those conditions. In the United States, in Georgia, where I am, 1 out of 3 African Americans have high blood pressure, at least 1 out of 3.
Right.
Okay, it may be even higher than that. And these are among adults. So we have to be mindful that in our communities, there are a lot of people with high blood pressure and diabetes, and they're at higher risk of developing severe COVID-19 disease. So we have to know that and protect our family and friends from this severe illness.
Okay. Right. Another question I have for you. When treated for COVID-19, does it mean there will be no recurrence?
We have heard of reinfection. You've heard of different variants circulating. And luckily, we have a couple of vaccines that are available. And you may have more in the UK right now. We only have 2. Others are in the pipeline here in the United States. But if you have a virus that is changing because it wants to live, it yeah. So it becomes a different look to our immune system, and it's called a variant or a different strain of the virus.
Right.
And and that is happening because of the transmission from person to person. But having a vaccine and giving a vaccine can help interruption of transmission from person to person, because a vaccine stimulates your immune response, but you don't get the full-blown disease.
Right.
That's what happens with vaccination. And that's why it's important to get the vaccine if it's around.
Okay.
So it'll help us reduce the amount of different strains or variants that are circulating in the community.
Right. Okay. I have one final question for you in the interim. Should people who tested positive be retested after treatment or after they've been in isolation?
Okay, so we're saying that someone who had the disease and they know they had it, they were tested and diagnosed, and then they had the symptoms and they recovered, and they want to know, should they get retested? Okay, at this time, I mean, in the United States, we don't necessarily recommend that they should be retested per se. And hopefully they would have been tested for antibodies to see whether they developed those proteins that we talked about, or maybe we haven't talked about that yet. But the antibodies are part of our immune system. Those are the proteins that attack the virus and neutralize it. And when we say neutralize it, it can prevent it from getting into your cells. So these proteins are very important. Test for those antibodies to see whether you have them. All right? And that's going to help protect you from getting the virus infection and the disease subsequently.
Okay.
Now, we know that these strains are happening around us too, these changes. So be mindful that there may be a booster vaccine coming down the pipe if needed to combat those changes that are occurring in the virus.
Thank you so much, Dr. Hutchins, AK. Quite insightful contributions you've made. Let me move on sharpish to our next panelist.
Thank
He's
you.
actually a chemical pathologist and pharmaceutical medicine physician who graduated from the University of Ibadan. He worked in the NHS as a senior health officer in the general medicine in Seacroft, Killenbeck Hospital, Leeds, Sutton Hospital, and also senior house officer in chemical pathology in St. Helier, also a registrar in chemical pathology at St. Helier and St. George's Hospital Medical School in London, pursued a doctorate in molecular pathology at the John Radcliffe Hospital in Oxford and returned to London as a senior registrar, also a lecturer in chemical pathology at the Royal Free Hospital Medical School in London. Completed his special training in chemical pathology and in 1999 appointed honorary consultant physician at North Hampshire Hospital, Basingstoke, where he still currently holds outpatient clinic sessions. Commenced his career in the pharmaceutical industry in 1997. Over the years, he has held several positions such as clinical research and medical affairs in diverse companies in the UK and Europe. He's also worked with BIOS, which is a consultancy and research organization, Pfizer, uh, to mention a few, Roche, also Icon Solutions, uh, Eli Lilly, and a host number of organizations. He currently provides pathology, consultancy, and pharmaceutical medical marketing services to laboratories, pharmaceutical and device companies. In addition, he is a senior lecturer at King's College London. He has a passion for bringing diagnostics closer to patients and integrating diagnostic and pharmaceuticals. Please join me in welcoming Dr. John Bolodioku.
Thanks, Anna. Pleasure.
Thank you. Now, this is a platform where we use layman's terms. I know you are medical, but then again, I have this here. You have a passion for bringing diagnostics closer to the patients and integrating diagnostic and pharmaceuticals. What exactly does that mean to somebody like me who is non-medical?
Well, I thank you very much. So the first thing I would say is, one, it's actually trying to make diagnostic pathology very simple and easy for the layperson to be able to use, especially like your glucose meter. Your glucose meter is the way a simple person measures their blood glucose with a little device. Cholesterol devices that people use, that's a passion of mine, of bringing self-monitoring closer to patients to start to use, and also pharmaceuticals.
Okay, thank you. You also had experience of COVID-19. Briefly tell us about this.
Yes, obviously, as you know, I've been involved in testing a lot of diagnostic tests for COVID. I stick swabs into my nose almost every day, trying to look for the antigen, take blood samples, looking for those little antibodies that are there. And one fateful day, I would say, this was actually the 14th of December last year, I developed flu-like symptoms, fever, a bit of rigor, chills, and I thought I'm having the flu. The next day, the symptoms continued and persisted, and then I had a slight headache also. At this time, I thought this is not just the flu. I don't get a headache with the flu. But what was even worse was when I started trying to climb the stairs, I started feeling short of breath. And that was obviously one of the symptoms we'll talk about, is actually one of the very prevalent symptoms with COVID-19. I immediately got my pulse oximeter, which is something that measures the oxygen, which you attach to your finger. It talks about how you're getting rid of the oxygen. And my oxygen saturation was dropping to about 87. It's usually should be between about 95 to 100. And on exertion, it was dropping. And I thought this must be COVID. So I stuck a few things up my nose, did a couple of tests, and it was positive. I didn't believe I had it. I was not very happy because I knew the consequence of what that meant. it meant I had to stay self-isolated. I did it again the second time at about 3 o'clock, and it was positive. I then went and got a confirmatory PCR test done, and that said I had it. And I had to go into self-isolation, cancel all meetings, cancel all face-to-face meetings, stay indoors. Food was given to me and brought to me. I couldn't see anybody, and I had to go on my 10-day of not seeing anybody. Now, being the typical chemical pathologist, I was taking blood samples every day, analyzing my interleukin-6, which are markers for inflammation, my D-dimers, which are markers for thrombosis, and even my antibodies. So I could actually even tell when I started to have my antibodies coming in. But I think what is more important was actually, according to the isolation laws, day 10, I could be free to go. Now, I kept on measuring my antigen in my nostrils, and I was still positive on day 10. And therefore, I still stayed indoors because I knew that I was still infective. And it was not until day 16 that I turned negative. And then I actually went out on day 17. So I think the lesson that I also have there is that realistically, whatever your isolation period is, it will be best to have a test done to still see if you still got the virus present, because not everybody clears up the virus by day 10. So that was it. And I was very fortunate. I probably had a very mild case of COVID, although I'm a Black Asian individual, Black kind of African individual, which people will say is a high risk. But thankfully, I don't have hypertension. I'm not diabetic. I don't have a high levels of cholesterol, and I'm reasonably fit. So I think I got away with a very mild form of it. I have to say that some of my friends have not been so fortunate who caught it around also the same time. Some of them were hospitalized. Some of them went into ITU. I even know a colleague's friend whose wife who died around the same time that I caught it. So I think even though some of us survive it, I think a lot more people tend to actually die from it if they've got a few other complications there. So I look back and I survived it, but it is there. It is real. The lung disease, I was still breathless for about a good 30 to 40 days after it. I couldn't go out and exert myself fully. I would still be breathless. The taste, the loss of taste also still persisted for at least a good 3 weeks after the disease. So it's actually there, it's real, but thankfully I had a mild form of it.
Okay, thank you so much for sharing that with us. This is me, ordinary Miss Anne. If I had something similar, would you say that, would you have some sort of tablets or antibiotics that one could actually use once tested? Or I would have to be in self-isolation?
Well, I think when you're in self-isolation, the most important thing you need to do is to keep yourself healthy. So you find, some people went and took multivitamins. I then actually boosted a lot of my immunity by taking a lot of my vitamin C, my vitamin D, zinc, all of that. So the key thing is eating well, keeping yourself very healthy, because that's the only way that your natural immunity can come up there. So, some people would say they want to go on to antibiotics. I didn't go on to any antibiotics. You should only use antibiotics if you've got a bacterial infection. Why would you want to put yourself on an antibiotic if you don't have a bacterial infection? So, so I would just say the most important thing you need to do when you're self-isolating is keeping your fluids up, making sure you're well hydrated, and keeping your general well-being up and boosting your immunity.
Right. Okay. You also talked about the oxygen level. As Black people, there is no way you could see the physical signs, as opposed to our Caucasian cousins, as I call them. You could tell that they're losing color already. So how can Black people be detected if they do not have enough oxygen in them?
Yeah, that's actually a very good point you make there, because when the whole thing came out initially, it was, have a look at the individual, and if they're going black and blue, you can tell they're losing the oxygen, but that doesn't come out well on a black-skinned individual.
Right.
And sometimes you also have the people who, when they lose the oxygen, they actually become happy and they're smiling. So actually, you won't know that they're actually desaturated. And that's why the simple pulse oximeter, I mean, you can actually get it on Amazon for about £20. That is something which I do believe is a great lifesaver for individuals to actually have, and just stick on your finger and see the level of oxygen you have. And the simple exercise is, if you try to run up the stairs and you feel really short of breath and you can't, there's a simple exercise to show that you're not getting enough oxygen in there. Right. But the pulse oximeter is a nice, cheap little piece of device which would help a lot of us, if we've got it there, to keep an eye on our oxygen saturation.
Okay. Now we're talking about different types of vaccines, and people are saying, no, it's the Pfizer, it's the Oxford one. So could you just tell us the different types of the vaccines, and what are the pros and cons of each one?
So I think, I mean, yes, the first thing is they're the different kinds of vaccines. But I think when people start trying to go into the pros and the cons, yes, it slightly distracts from actually what they all do. All vaccines are naturally, whatever way they're created, either by messenger RNA or they're the vector virus that's carrying them, the main thing they do is they present the spike antigen, which is like the spike that the virus has, in which it goes into the cells. Mm-hmm. And our bodies generate antibodies to that spike protein. That's what all of them do. All of them raise those antibodies. That's whether it's the Pfizer, whether it's Moderna, whether it's Sputnik, whether it's the Chinese one, whether it's AstraZeneca. That's fundamentally what they all do, to raise the antibodies. Now, some of them, because of the technology that has actually been used in bringing it about, is where you might get the different ones that are messenger RNA created ones, or the ones put in the actual vector virus, an adenovirus vector. So I think, and some of them, because of the messenger RNA one, for example, that's got to be kept cold, very cold when it's transported. And that's why you might have heard, in terms of the logistics, it's got to be kept in a real freezing temperatures. But I think let's go back to, what do they all do? They all raise the antibodies, irrespective. Their logistics around them might differ, but they all do the same thing. So I would say there is no difference when it comes to actually them raising your antibodies. They're similar when it comes to that.
Okay. Can someone who has been vaccinated still infect others with COVID-19?
That's a very good question you ask. Now, if you think about it, yet the vaccination takes care of what's in the blood, not necessarily what is in the nasal passages. Mm-hmm. Now, one or two vaccines might be saying that they might help in the transmission. We're still yet to see that, but actually you can be vaccinated and still harbor the virus in your respiratory passages. So effectively, you can have a vaccination and you can still infect other people, which is still the reason why you're told, even if you've been vaccinated, you still have to wear a mask, you still have to wash your hands, and you still have to adhere to all the other conditions around keeping this pandemic under control. You don't just have the vaccine and you're Superman or Superwoman and you go out there and continue to live life without adhering to those things. So the answer to your question is, you can be vaccinated and you can still spread.
Then if you're saying that to me, I'm thinking to myself, what's the point in me going for the vaccine? Why don't I just stay the way I am?
Now, just as Dr. Sani pointed out, the main thing of the vaccine is it stops you from becoming critically ill. That's the bottom line. Now, you and I got a very mild form of the disease, but prior to catching that, I didn't know whether I was going to be somebody who was going to have a mild form or a severe form. So the bottom line is, if you don't know which side you're going to fall on, what you would like to do is to have something that prepares you and doesn't allow you to have the severe disease.
Right.
So that's the bottom line. It's the severe disease that the vaccine prevents.
Okay. What's the order of priority of the vaccination? Especially, I don't know whether there is a blanket priority list, or the way it is in America is different from the way it is in the UK here.
Yeah, yes. I mean, I think it will differ, but I think there's a few principles that you would use. So you will start to look at your more clinically vulnerable individuals. So there's no doubt if you're above 80, above 90, you're naturally going to be you're more vulnerable than a 30-year-old or a 40-year-old. So that age group will be put on the front list to be vaccinated. And that's why you can see in the UK, everyone above 80 has, I believe at this point in time, now been vaccinated. Then,
Right.
then the age group will come down again to about 70, then to about 60. And then, of course, if you're a frontline health worker, that's because you're coming in contact with it. So you might see a 40-year-old going for a vaccination, but he or she is probably a front worker and coming in contact with people who will have the disease. So that then puts them up there. People in the old people's homes too, where they're also the ones on the top of the list to be vaccinated. But you would obviously see that if you're a 30-year-old, 25-year-old who's very fit and healthy, you have no other diseases, you're probably down lower on because you're more healthy and more fit. So that's kind of the natural way you can say that the vaccine's been rolled out, is the more vulnerable individuals will be the first in the queue and the first to get it. So the stronger you are, potentially, the more behind the queue you would be.
Okay. I see you nodding your head there, Dr. Hutchins-Eke. Is it any different in the US?
It's similar in the United States. We are vaccinating those who are at highest risk for exposure and also serious disease. For example, healthcare workers are part of the first group to be vaccinated, as well as older adults that are 65 and older. And then we could move on to those who we call essential workers, our public safety, our firefighters, our teachers, essential workers. And then the third group are those who are younger than 65, but have these underlying, conditions like diabetes and hypertension.
Okay.
And then after that, it's everybody else.
Okay.
So we have these priority groups in that order.
All right, then. Thank you very much for that. And now back to you, Dr. Bolodioku. Could you tell me, can someone refuse to be vaccinated if not convinced about the adverse effects of the adverse effects of the vaccine? Say, for example, I came into a surgery and the GP offered me the vaccine, and I say no. Can I refuse?
Yeah, I mean, I think that's a bit of a notion that people believe that it's mandated and it's you must take it. Actually, it's a free country. You can decide not to. I mean, that question is very interesting because, when you look at it, yes, you could say no, you don't want to take it, and that's you've taken your life into your own hands. Just like in normal practice in my clinic, I offer medicines to patients, and there are patients who walk up to me and say, "Doc, I don't want to take the medicine," and I say, "Fine, sign here and say you don't want to take the medicine and you can go." So it's the same thing with the vaccine. You don't have to. Now, I think what people must bear in mind, and I think this is where it becomes a little bit tougher, is you might find there might be one or two places that might insist. So, for example, you might get a country that says if you're going to visit this country, let's face it, I was going to Nigeria a couple of years ago and I was told I was not going to be allowed into Nigeria if I didn't get a yellow fever vaccination. Oh. So there I had to go and subject myself to a yellow fever vaccination and get a certificate before I could actually fly into Nigeria. So now you might get a situation like that. We don't know what might happen, but you might get a country that says, we're not going to take you on the airline if you've not had a vaccination. So you might then be put in a total different dilemma if you've not taken the vaccination. So I think, but the answer to your question, no one's going to force you to take it if you don't want to take it.
Okay. Now let's talk about some myths surrounding, well, we don't even know whether they are facts. So don't let me say that. Myths or facts, we're not sure. But some concerns which some folks within the Black community have. And one of them is this: there has been some rumors that something is being injected into people that has an enzyme which rhymes with a biblical terminology. What's your opinion on this?
Yes, sadly, I was reading that, and it's something that interests me, because one of the enzymes, there's actually an enzyme that was actually used in the development, and it sadly has a name called luciferase.
Right.
And obviously, if you take out the A's, it's Lucifer. And obviously, you can imagine what that generates: a whole lot of antibodies in a whole group of people. And now, but if what everybody forgets is Lucifer comes from light. And everybody forgets that Lucifer was an angel of light. And Lucifer is the enzyme that's used. So this enzyme tags and it glows. And it allows us to be able to identify where the virus has gone to, where it's attached to. So the problem people have is, you can then imagine somebody saying, oh, they're tagging individuals with luciferase.
Right.
All of a sudden, somebody could say, well, that's Lucifer, they're tagging you. And guess what? They can actually, it glows and people can find out where you are. So I think, unfortunately, that poor little enzyme that's been named luciferase has probably caused a whole load of confusion in people's minds. And some people have said, oh, that the Antichrist is being injected into you, or has been used in that development. So I think that's something there which unfortunately has played wrongly into people's minds.
Was it the name of the enzyme? Was it coined few years ago, or?
No, it's a firefly. You know the fireflies. You know what the Yorubas call bano. Those little that light up. Those that light up. That's it. It's a luminous fly that it has that luminescence. That's where it's come from. So it's just unfortunate that, I mean, I've been using that enzyme in the lab without even thinking, until somebody pointed it out to me and said, have a look at that name again. And I looked at the name and I thought, oh gosh, of course, Lucifer. So it's it's what it is, and unfortunately it does slightly derail things a bit.
All right. Okay. What's your opinion on the theory that the vaccination was or it's a process, and the vaccine itself was developed, or the various vaccines that we now have, they've been developed in order to depopulate Africa, because we seem to be increasing.
Yeah.
One family, you can have 8 children, so maybe this is just another way of injecting some family members, and they sort of.
Yeah, I mean, I think what we have to not forget is, yes, some companies, and even Pfizer that I worked for many years ago, did have one or two things when it came to doing clinical trials in Nigeria, and which had a bad taste. It was not conducted quite properly. You have the Tuskegee kind of affair many years in America, where people were experimented upon of the Black African group, for syphilis. Penicillin came in and they were not advised about it. So we have a few would I say the pharmaceutical industry has not been a very trusted organization. Okay. So I think one thing we've got to bear in mind is the two organizations that are pushing it, the government and the pharmaceutical industry, are two organizations that people don't like anyway. There's a high level of distrust. So I would say that that's unfortunate, because I would say something, a lot of vaccines are being tested in Nigeria for many years, and still Nigeria is one of the most populous countries in the world. So obviously those vaccines haven't worked if they were testing them to depopulate us in Nigeria. And if you look at the moment, I think actually Africa is way behind in being vaccinated. Everybody else is being vaccinated. So I don't seem to understand why we as Africans then feel that we're being depopulated if everybody has got the vaccination first and without us. So it doesn't add up. I don't think it adds up if it's out there to depopulate us as a group.
Yeah. So you can imagine the concerns of people. You have the issue of Lucifer being behind this vaccines, and then again, you also have, so many other concerns which they have from a spiritual perspective. Also, the fact that the pharmaceutical industry itself. Has a question mark over its head, in the sense that some people just don't trust some pharmaceutical companies.
Yeah.
People believe that they're just there to make money. They come up with this form of vaccine, and it's a way of making money. So it's quite understandable, isn't it? So how do you think we can encourage the black people to go for the vaccine?
I think
Given all these theories.
I think the most important thing is, one, I think people do not like to be forced into making a decision. Mm-hmm. I think that when somebody first came out and said everybody must take it, I think people don't like that. People like to feel that they're taking a very well-informed decision. And I think that is actually what we're here to do. I mean, I'm not here to really force anyone to take the vaccination. I'm here for people to have a very informed decision as to how actually they want to go about it. And I think also the scientific community also has to be also very honest. There's some answers to questions that we don't have, we don't know. And I think we also have to be very open about that, because sometimes when we get cagey about that, it doesn't help in driving the trust. It doesn't help in driving the trust, because yes, one of the questions is, how long is the immune response of the vaccine going to last? We don't know. It's still ongoing at the moment. We're still looking at that, So these are little tiny things too that people also have to appreciate. The vaccine, I mean, people think it was done in warp speed, that it was done so quickly. No, it went through all the normal regulatory processes that everything could do. All the regulatory authorities went through it. People forget that the governments and all the companies came together with a lot of knowledge and a lot of money to try and make this happen for the whole world. And people forget that those are things that actually made this really happen. And, I think people just need to realize and take an informed decision. They're not being forced into, they need to go back, think about it, pray upon it too, and also, think.
One last question. There's also the concern that some of the vaccines are labeled not for Africa alone. And, I think it's something to do with the labeling. So they mean that there's a different type of vaccine for Africa to kill them.
Well, I think, first of all, I find that very funny, because I think if you actually look at it, if people wanted to really kill you, would they really label it up front for everybody to see? So I think with labeling, these vaccines are being produced in many of the countries, and batches are being put aside to be transported to different countries. Now, if a batch is put aside to say that this is for the African continent, it's put aside from a logistical point that don't touch these vaccines. These vaccines have been earmarked to go to Africa. Do you see what I'm trying to say? Just like it will have, these vaccines are earmarked to go to Europe. These vaccines are earmarked to go to the United States, because these vaccines are done in other places. So just because you see a label to Africa, I think we need to ask ourselves before we start coming to a conclusion that, it's been designed, it's for Africa, and therefore there's something sinister about it. I mean, I was even trying to look at all the vaccines I've seen. I haven't seen any labels like that. Okay. I haven't seen any labels, but I would like someone to show me those labels. And I think those labels are related to the packaging of where that shipment is being sent to.
Okay. Is it true that the vaccine are the same ones developed for the treatment of SARS?
It's come from, let's remember, SARS was there to start with, and Dr. Sani probably can even explain this more. We've had SARS before this, and actually people would have been looking at vaccination processes for that even back then. What has happened is this is just a development. What we've got is something that's been developed in the past for SARS. And that's why people have to realize that it's not that technology was just not picked up in a year or two ago. We have found something that we've been working on and pushed it and increased it. So yes, it's the knowledge of the SARS back then is what we've still used to come up with a vaccine at the moment.
Okay. All right then. Thank you so much for that. Very informative. Dr. Bolodioku. Now we have the next person on the panel to share her experience with us. She actually had COVID. She's a trained lawyer, social worker. She works with women that have suffered from domestic violence. She had COVID in March 2020. I think this was when we started hearing about COVID. She was hospitalized for 59 days and she was in coma for 32 days. Because of her experience, she was actually interviewed by the BBC, which the recording will be released later on sometime this year, I guess. So please join me in welcoming Olori Dr. Shola Doyle.
Says you on mute. Yeah, I'm unmuted. Thank you.
All right. Welcome, Shola. Could you briefly tell us, how did it happen? How did you end up being in hospital for 59 days?
Firstly, I don't know how I caught it. That's the first thing, because I stopped work in January. I hadn't been feeling very well. I had sort of few things that I wasn't feeling very well. I just kept feeling like I've got a headache or I've got, body aches, but I didn't count it as anything until early March. And then I was at home that evening. I was just so hot. I was literally burning up, and I didn't have a thermometer, but I knew that I was excessively hot. I had the window open, and you can imagine the weather in March. I had the window open, I had the fan on, I was wearing something like cotton, cotton agbada. So I was just burning. So I dialed 111 and they kept saying they'll get somebody to call me back, So like 5 o'clock in the morning, I just dialed 999. I was just too hot. I couldn't lie down. My bed was like it was on fire. And the ambulance came and took me to the hospital. And then I'm not sure, but I think they admitted me 2 days later whilst I was still in hospital, but I hadn't been admitted. But as I say, I've got no recollection of that at all.
Really? When you say you don't have recollection of that at all, during the time that you were hospitalized or all the things?
Yeah, initially, like until I came out of hospital or till I came out of the coma, everything was still a bit fuzzy. Even when I got home later on, it was still a bit fuzzy. I had to start, putting fact together with what I thought and what I'd experienced during the coma. Every single day of the coma, I had as far as I know, I had a different type of dream.
Right.
So there was a lot going on in my brain. But when I woke up and they said, "Oh, you've been here for 32 days," I thought she was crazy. I thought the nurse was crazy, literally. That how can I have been here this long and I didn't know? I thought I'd been kidnapped. In my dreams, I kept seeing that I'd been kidnapped. Right. So as soon as they gave me my phone, I couldn't even operate my phone. But as soon as they gave me my phone, I phoned my son and I was whispering, "I've been kidnapped. I'm in Southend Hospital." And he was like, "Yes, Mum, I know." So then I was like a bit confused.
So did you, obviously, they must have...
I can't hear you, sorry.
They must have conducted some tests on you?
Yeah, well, as I said, I was in a coma for the first whatever days. So my son was my next of kin. So they'd phone my son and my son would phone my pastor, who's also a doctor. So they would, they said, "Oh, we want to try this on her or we want to try that on her," which was actually the Oxford trials.
Right.
And they agreed to it at the time that, yeah, please, anything that would save her life. I wasn't aware of all this. In fact, I wasn't aware of the Oxford trials until about 2 weeks ago when they sent me a thank you letter.
Okay.
You know, so I think they tried a lot of things. I've had the trachea here, so I was on ventilation for all the time I was in under the, you know, in the coma. All the time I was in the coma, I was on ventilation. So
Dr. Bolodioku, would you say that Shola was one of the lucky ones?
Yeah, I mean, I think yes, without a doubt. I mean, I think I mean, just as I say, you have a range from people who have kind of very mild, or you know, like what I got, to people who immediately go into the hospital, are put on ventilators, and you know, actually some of them even die. So I think, so if we're using death as the worst case scenario to be in, then yes, she's without a doubt a very lucky one, because you could say literally she was saved from death. I mean, she's alive here to talk to us, so she's a survivor, as you put it, and you know, we're grateful to God that that's happened. But yes, I mean, it could have easily been the other way.
And with the organs intact, especially the brain.
Yeah, without a doubt.
Oh, wow. Thank you so much for sharing your story with us, Shola, and we wish you well. Thank you.
thank you.
Now, let's move over to the spiritual perspective. You would not believe the number of text messages I received. I contacted about 10 religious leaders. They were not going to come. Some people sent me text messages and quoting the Bible and everything. It's all very good. But then again, I would have preferred if they came here to share their own opinion on the vaccine with us, you know, and I'm sure they will make reference to what Dr. Bolodioku has said to us regarding Lucifer being behind this vaccination. However, I'm so lucky to have a man of the cloth here with us. He's an accountant, and in 1991 he got ordained as a priest of the Church of England. He is currently the vicar of St. Olaf's Church in Woodbury Down in London, and is also the predicatory of St. Paul's Cathedral since 2007. Welcome, Venerable Tunde Roberts. Venerable Tunde Roberts, can you hear me?
Yes, now I can hear you.
Okay.
Thank you, Sister Anne, and thank you for having me.
Thank you for being here. Now, what are the preventive measures in place for your congregation? Because the little bit I'm doing here, I see it as my individual social responsibility. What is your church social responsibility towards your congregation as well as the community in which you are situated?
Okay, greetings to everyone. In terms of preventative measures, right at the beginning, the Church of England was, they were speedily off the blocks. At the beginning, the Church of England mandated every parish, every cathedral church, and all the other institutions under her care to carry out a thorough risk assessment of all our buildings to ascertain the likely and possible risk to members of the public, and including all the users of our facilities. Now, when it comes to St. Olaf's, we complied. And by the time we returned back for public worship after the first lockdown, and I think it's on Sunday, the 5th of July, 2020, a copy of that risk assessment was sent to every member of the congregation and all the users of all our buildings. and it was sent by WhatsApp, it was sent by email, and it was sent by text. And hard copies were pasted at the entrances of the church. And those preventative measures included 21 items. And I'm quickly going to go through them, if that is okay. So there are two entrances by which you come into the church. So you come into the church from one entrance and you go out through another. As soon as you enter, you must wash your hands in the toilets at the two entrances with the automatic soap dispenser and electric hand dryer to dry your hand. Also, thermometers were provided to check your temperature. And then the third thing that is on that the thing we put together is that hand sanitizers were provided. So we had hand sanitizers at every of the entrances. We have 4. So you come in through 2 and you go out through the other 2. And we have hand sanitizers provided. We also provided disposable mask and gloves. That was there, and we still have it up to today. And then we introduced a one-way route into the church. So you can only come in through one side of the church to go to your seat. And when you come for Holy Communion, then you have to follow that route as well. So you don't actually meet somebody on the way. And you maintain social distance all the time. The service booklets that we give to you, you use it or you dump it. Nobody's going to use it. We sort of put away all the service booklets we used to have. You cannot use it a second time. So every week we provide service booklets for our members. And the seating arrangements clearly marked 2-meter distance between sitting. And if you're from the same household, of course, you can sit together. But if you're not from the same household, then we don't encourage it. Congregational singing were prohibited because, like many of the 2 doctors said earlier on, you can easily pass it on through mouth. So we prohibited that. No physical contact. When you have the peace, before we used to hug, we used to kiss and so on, but no physical contact during the peace. You remain in your seat and just wave to your fellow being. So during the offering, we used to carry the plate around, but now it's in one place in front. So you move to the front, leave your offering, and go back to your seat. During communion, you maintain good social distance. Like I said, you follow that flow route and all the other informations given. And of course, we don't use the same cup. So you have little cups. The Sunday school was suspended. There was no way we can continue with Sunday school. So we suspended that. And we made sure that those children that still come to church are well looked after by their family. The doors of the church were left open for proper ventilation. All the doors were left open for proper ventilation. And food, drinks, and other refreshment must not be served in the church building. So those are the few things we did. After the service, of course, you exit in an orderly manner, and you exit from a different door from where you came in. And we maintain names of attendees. We have record from July up to last Sunday, so that we can keep track and trace if need be. We've got records of that. And on leaving the church building, we encourage everyone to wash their hands thoroughly. And if you have any symptoms, we made it very clear, like cough, temperature, loss of taste and smell, sore throat, even fever, please don't come to church. Very important. We made that very clear. And those are the kind of things we use as preventative measures for our own congregation at St. Olave's.
Thank you very much for that. That's a very comprehensive list. I was just thinking to myself that, is it because you're a Church of England and you don't have any choice? If you were the pastor founder GO of St. Olave's, would you be able to afford all that? This is my question to so many of these pastors, because you just need to go on social media, especially Facebook, and you see a lot of face masks being turned into chin masks because they go under the chin and people think they're covered. It's unbelievable, and you see a lot of people, I don't even think they take any register. It's like church service as normal, but it's no longer normal because of COVID-19. So I'm quite pleased to hear this. And hopefully the people who have been contacting me, maybe I'll just send the recording to them if they haven't been adhering by the safety protocols of COVID-19, they will learn a thing or two from your church. Thank you so much for that.
Can I just mention something quickly?
Yes.
Because it's about caring.
Right.
I said at the end of my assessment, I said, please remember,
Right.
Christ is love.
Mm-hmm.
And therefore, we ought to love one another.
Yes.
In all that is going on in our world today, let us continue in the love of God and to be our sisters and brothers' keeper. Yes. As safely as possible. So it's not about, it's about caring. Yes. For others.
Exactly. Not just taking care of yourself, but people around you as well. And that's the message that needs to actually go out to them. What's your opinion on the theories that the vaccine is of the devil?
Well, I don't personally believe that, because on Thursday, the 4th of February, this last Thursday, my wife and I took our first dose of the Oxford AstraZeneca vaccine. Of course, it is a personal decision. However, as a leader, as a priest in the community, I have been encouraging our people to take the vaccines. It is not true. It is not of the devil. Many of us take flu vaccines. I took it earlier on. We take even paracetamol when we have headaches or when we have body aches. We take other medicines. When we go into hospital, it doesn't matter whether you're a pastor or a priest, for a surgical operation. Things are administered to you that you don't even know. Once you're asleep, you don't know. So why don't we say it is of the devil? So as leaders, I believe we need to encourage and educate our people that this is not true. And we must not push conspiracy theories or push things that we don't know. I'm not a scientist. I'm not a doctor. I trained as an accountant and later as a priest. So things I don't know, rumors, conspiracy theories, I don't believe we should be pushing that. Microchip conspiracy, that the vaccine contained a concealed microchip to track people, altering human DNA. That is not true. Because I said to my congregation 2 weeks ago, if the government and the authorities really want to track you in this country, they could go through internet data, your financial history, your mobile phones. Enables that to happen. It's there. I spoke to a pastor friend of mine yesterday who is in the Pentecostal tradition, and we are on the same level. he sent a lot of information to me to read. And so people like him actually believe that what is being propagated, what is being, the lies that are being spread are not true. So that's my take on it. I think it is not true. It is not of the devil.
Thank you so much for that. I remember that towards the tail end of last year, I received some prayer points from a pastor, very, very prominent pastor in Nigeria. No second wave in Jesus' name, do this, do that. And I thought to myself, there is a second wave right now. I told him, I said, well, would you like to come and defend what you read there? Oh, we're still praying about it. So a lot of them, they're praying about it. Well, we thank God for them. We thank God for their lives. But we also thank God for the medical doctors, because they have been created for a reason. And without them, nobody will be here when we're ill. So let's just move on sharpish. I have somebody here who is also a campaigner for the vaccination. He's an IT consultant and is also a volunteer at COVID-19 Vaccination Center in Beckenham, Kent. He works there weekends. And this person is trying as much as possible to get the Black community to go for the vaccination. Or to go for the whatever the different types of vaccine you want to go for. He's just saying that it's a lot better in order to ease the pandemic, especially healthcare facilities. For example, in Nigeria and other parts of Africa, already the healthcare facilities are a bit substandard. And then again, you have people roaming around who are not taking care of themselves. So we have somebody here who is based in the UK and is really campaigning for people to actually go for the vaccination. Please join me in welcoming Fred Adigeye. Fred, can you unmute yourself, please?
Okay. Thanks, Anne. Thanks for having me.
All right. Tell us briefly about your role as a COVID-19 vaccination volunteer.
Yes. I'm minority, so as you must have heard, but I'm a member of Rotary Club. I was a past president of Rotary Club in my local area in London, Orpington, and we helped in eradication of polio by doing the vaccination all over the world. So when this came up, this vaccination for COVID came up, we were asked if we would volunteer. And I looked at it. I've lost a friend. I'm in my mid-50s. I've lost a very close friend to COVID when it was one of the people that was admitted when Shola had it. It was a mental health consultant. My daughter is a frontline worker. She's a doctor. My wife is a frontline worker. She's a doctor. And they come home with these grooming stories. Majority of my friends are doctors. So I thought, no, I have to volunteer. And a few months ago, when the first wave came up for the vaccination, I volunteered. I was at Beckenham Hospital. And that weekend, we did over 2,500 on Saturday and Sunday. It was a double-hour shift. And out of the 2,500, I could count with two hands how many Bami, both Asians and Black. And this is really predominantly majorly white area, but more than 20% of Black population in that area. And I thought, oh my God, what is going on? And this, I now bring it to my friends, and we bring it to the forum, and we have a forum for our Nigerian UK Golfing Association, and people were saying, oh, this, and people were, and I thought, we need to do something about this. This is killing us. And we have the highest proportion of death based on percentage. In UK, 33-point-something% of Black people are dying, and we are just less than 8%. of the UK population. You can see the gap. And we are the people that are saying, oh, it's God devil this, it's God devil that, they want to kill you. The Queen took it. If anything the Queen take in this country is likely safe, they will not give it to their Queen. And the doctors are, the white people are taking it. They're not that they say, oh, black people go to this place, white people go to this place. Everybody is taking it. You kill on the same line. So that is a short answer for that.
Okay. So have you actually received the vaccine yourself?
Yes. As a volunteer, I was offered, because if you are making contact with 2,500 people offshore, so they offered us and I took it. I took it 3 weeks ago.
Right. Thank you very much for that. I just want to quickly bring in Dr. Toyin Magbabiola. She's a psychiatrist. Could you tell me what goes on inside the minds of people who hear stories like Shola's own, and also Fred Adigeye telling us about few Black people opting for the vaccine? You have Dr. Bolade Oku there, Dr. Sonia Hochizeke saying, look, this is necessary in order to ease the pandemic, in order to release the stress on the healthcare facilities that we have, never mind in Nigeria, of all places. And they are recklessly going to parties, not even using face masks, and tell them to go for self-isolation. Some people even lie when they have COVID. It's not my portion. Whose portion is it? What do you think goes on in the back of the minds of people like this?
Good evening, everyone. Thank you so much for having me, Anne. Well, psychologically, we're very different. And I think sometimes the circumstances in which we find ourselves makes us think in a completely different mindset. And like somebody said earlier on about the trust, a lot of us, especially Africans, I'll say specifically Nigerians, feel we have this cover in code, where the classic word is, it's not my portion. So because they think they've said the word is not my portion, therefore nothing will happen to them. But I always say, even with faith, how faithful are you in yourself for you to say, my portion, it's not my portion? But also, there's also the psychological aspect of the need for us to interact and socialize, almost to a point of addiction. That's the way I look at it, where they think there's this need, they need to go to these places because they've been invited. They don't want to disappoint people. They need to be there for whatever reason, sometimes financially, because sometimes I say to people go to parties to enjoy the food, to socialize, but some people actually go to parties to connect and meet people who they can actually get money from. That's the reality. So the thing that actually drives them to carry on going to these places is not as simple as people see on the superficial aspect of it. They also believe that because the people they're going to see are actually their friends. So psychologically, my friends are okay. My friends behave this way. So therefore, there is no way they can have COVID. So if I think they're my friends, and I'm the way I think they are, then it is okay to be in that environment. And it's also the misunderstanding of what COVID is itself. Because you hear people who, they go to parties, they wear their mask, they social distance, or a friend they haven't seen in a long time comes along. And what do? Naturally, they hug themselves. Or you can be together, you're all having a good time at the party, socially distancing, and then you want to take pictures. And because some of us are very materialistic, fashionistas, we don't want people to see us in a mask because we want the pictures to be on point. So what do? They take off their masks, they take a picture, and then they put their mask back on. That gives room for transmission. So psychologically, it's more a case of, it's not going to happen to me because my friends are okay, so therefore I can go out. And personality-wise, some people feel, why should people tell me what to do? Because if you look at personality, some people think they need to be in control. I need to make the decision where I need to go, how I need to dress. and I don't want anybody else telling me what to do. So on the personality side, that also causes an issue whereby they want to make that decision and nobody has a right to tell them.
Interesting.
That's some of the things that might cause them not to engage with guidelines.
Or do you think that people are suffering from, let me even quickly direct the question to Dr. Shenu here. Do you think people are suffering from, I wouldn't say mental illness, but they are struggling with the self-isolation? If you recall, we had the very first virtual meeting shortly after the onset of the pandemic, around about the 11th of April last year. Do you think people are struggling to cope?
Can you hear me?
Yes, we can.
Yes, I actually did give a talk to another group on the mental health effects of COVID-19. That was in my role as somebody who is mental health trained. Even that's not all I do all the time, because I have a lot of access to the data, which was very thin on the ground to start with, but it's a lot more now. The bottom line is this: we are social animals. And despite what Dr. Mark Bagbiola said, everybody loves a good party. And after 10 months of not having a good party, seeing people die, because there's that too, not just healthcare workers, almost all of us have had somebody die around us. And then, of course, there's the huge amount of financial strain, the fact that people have to be in houses together. And some of us have big houses, but some have really small houses, and the amount of cohabitation they have to do is really telling on their mental health. So anything to break the rules. So there's a sort of rebellion where even people who should know better think that this is a government form of control, and they do everything they can just to unwind. Unfortunately, it makes the situation worse because the transmission rates go up. And, so yes, the mental health impact is real. Right. And unfortunately, it is what it is. All of us have had to get to the recesses of our resilience, right, to get through this. And it's still an ongoing thing. Right. That's bottom line. I'll just add, before you ask your questions, when Dr. Ortiz was talking about social bubble, in the UK, there's a slightly different connotation to it. And usually it can be somebody you don't live with, but who you see regular on a one-to-one, who may be looking after you. And it usually tends to be one or two people at most, which is different to the healthcare bubble. But what people do is they abuse this, and they still go out there. And of course, this pandemic rages on. So there's no doubt about the mental health. But it tallies in with the fact that the disease is not slowing down. So we are not doing the things to help the disease to slow down. So it's not slowing down. So the very thing that's causing us to have these measures in place, which we all don't like, we are perpetuating them either consciously or unconsciously. I don't know if that kind of answers your question.
Yes, it does. One thing I just found interesting about the whole thing, or really sad at the same time, is the fact that if you were to ask the so-called elite, educated ones, they will tell you about a friend of a friend, or somebody even close to them, or even a relative who has passed on. But when you ask somebody on the street hawker, they don't even know anything about COVID. And that's what I keep on saying. These are people, even immediately they were born, they've been taking herbal drink. And then if they're going to school, they'll probably walk 4 or 5 miles in the sun. But with the so-called elite, it's from one air-conditioned room, it's straight into the car, air-conditioned car, straight into the air-conditioned office and back again. So there is no vitamin D taken. There is no sun in any shape or form that they go under, and they brazenly just violate the COVID-19 safety rules and think, well, nothing's going to happen to me. But unfortunately, the next thing, you don't want to know the number of service of songs I've attended on Zoom. And I'm sure majority, if we were to take a show of hands here, people will say the same thing. It's rather sad. But I hope people would learn from what we're saying here, to be quite honest, that COVID-19 is no respecter of persons, whether you are illiterate or whether you are educated. And the funny thing is, well, from the people I know in Nigeria, all the people I know, they are educated. It's rather sad. They are educated. Who should know better? You just need to see on Facebook. I mean, I was saying to one law enforcement officer in Nigeria, if you want to catch people, just come on Facebook. The moment you see them open up their worship centers, whether it's the mosque or the church, just send your boys in to go and lock the place up, because they believe that there is nothing wrong. And unfortunately, some of the religious leaders are very reckless in what they preach. And then again, you find people, organizing parties, fully packed, and it's just rather sad. It's really sad because some people should still be with us today, but due to the fact that people just think they're above the law, even legislators, you find them organizing social events during this lockdown period. Well, the last but not the least that I want to introduce to us, she was saying to me, and she sort of like gave me an analogy. Oh, you know what, Anne, I really need to go for a stroll. Because even if it's a dog that's been locked in 24 hours of the day, the dog needs to go for a walk. So this person said to me, let me go for a walk first before I come on the platform to share a bit about myself to people. She's an accountant and a cancer survivor. She had breast cancer around about 11, 12 years ago. And probably about a year or two ago, she also had ovarian cancer. But thank God she's with us today. She has also gone for the vaccination. Please welcome Tolakbo Ogunleye.
Hello,
Welcome.
good evening, everyone. Thank you for having me today. And thank you, Dr. John and Dr. Sonia. I am a great advocate of cancer, COVID and everything, and I sit among medics, advisory committees and things. So everything you're saying, I get it. But people in my community, how do we go out? You know, this message, I keep thinking we still need education, awareness. We're all talking here. Some people, before I went, I was scared. I called Anne. I'm like, me too, I don't want it though. I don't want it. And my prayer group prayed for me about it. I said, no, I don't want to take it. But I'm glad I'm on this panel because I think I've learned more of why I should do it than not to do it. Even before I left my house, my daughter lied. I said I was going to the GP. I wasn't going to the GP. She said, Mom, if you die, how much will they give you? You know, which one are you taking? She even calls it Uncle Pfizer or be Uncle Zeneca or one of them. So honestly, especially in our community, because like someone said he lives in a dominant, like white community, white, I'm here. And sometimes I'm trying to advocate, but most of the people I'm advocating, they know what to do. But in my community, people still are, we don't want to do it. Oh, they want you. I told somebody the other day that if Bill Gates wants me, I'm happy to be delegate, let him buy me a mansion. I don't care, so we still need this education. And I'm happy the doctors are here. You should be doing this. I don't know how you can televise it, how you can go to the world, spread the word. We need people. If I don't see someone like me representing me, I won't listen to you. This is me, because my story of cancer was, Black people don't do cancer because I didn't see someone like me. But people like us now, we're listening to each other. I bet tomorrow somebody will wake up and say, if they offer me this vaccine, I'll go and get it. Because I've heard from people like me saying they've got it. I went for it. I was scared. But I think I'm more enlightened. It's more informative. Everything you've told us today, I was like, wow, I don't want it to end. I just want us to go on and on and on till somebody really goes and get this. So thank you so much. And Anne, thank you for organizing this. And I'm so glad to be here. And I'm looking forward to the second dose. Thank you.
So what type of vaccine did you have?
Oh, actually, I had the Oxford one because we had this theory of the Pfizer one kills every Nigerian. So, hey, I got the Oxford one.
Let me quickly take thank you so much. Let me quickly take some questions from the chat box. Somebody said it's one thing to educate and another thing to listen and learn. And I think that's quite key. One question I had from Bumi was, What about people with sickle cell sufferer? Maybe she should unmute herself and ask the question, because she said, please, can you kindly answer the question about sickle cell sufferer above? I'm not quite sure what the question was. If you can turn on your video and ask the question, please. Is she there? Okay, let me take another one.
Yes, sorry, I was trying to unmute.
Okay.
Yeah, thanks for taking the question.
Okay.
It's to do with someone with a chronic sickle cell condition who's also got some other underlying medical conditions. And in the beginning, when the vaccination was brought out, they were told not to take it yet because this hasn't been tested on people with those particular conditions. And at the same time, the person is shielding and is clinically extremely vulnerable and does want to take the vaccination, but doesn't know what side to believe. And if the vaccination is safe, which one of them should this person go for? Thanks.
Who's going to take that? Dr. Bolodioku or okay, all right.
I mean, I think so the first thing is, in the clinical studies that would have been done on all the vaccines at the moment, will not probably have included people with sickle cell disease. That's a fundamental. If we look at even the Pfizer study, only about less than 10% of the participants in the Pfizer study are of African origin. So, so then if you're now looking for an African who had sickle cell disease who was in the study, that is even going to be like trying to, find it's an impossible thing.
Yeah.
So actually, all of them will tell you we did not have anybody with sickle cell in our study, and I think that is just they're being honest and factual, because if they haven't studied in you, they do not know how it will react or behave. It's the same thing you get even with a 90, 100-year-old who's vaccinated. I can assure you there was no 100-year-old who was in any of the studies, because we tend to cap it about 18 to about 80. Yeah. But yet, if you actually look at it, all the 100-year-olds would have now been vaccinated. Do you see? They would have all been vaccinated, yet there were no 100-year-olds in the studies. So I think, and this is where your doctor's probably looking at it, is they're just trying to wait and see. I can almost think that it's most likely the person will be advised later on to go ahead and take it. They just need a few more numbers to take it. Now that it's been rolled out to a lot of people, there will be people who actually have had sickle cell disease who have been giving it, and people would know there's probably not much of an effect. Now, from my point of view as a scientist, when I actually look at it, we know that in COVID-19, there's a bit of a hyperviscosity or hypercoagulability that's actually seen in some of the patients. They have high D-dimer levels. Now, one of the things we know with sickle cell disease is the risk of thrombosis. So actually, I would almost err on the side that yes, actually, if you've got sickle cell disease, actually, you probably do not want to have severe COVID. So the risk benefit is actually what then comes into the equation. And I will not be surprised if we soon see that people with sickle cell disease or traits can actually take the vaccine. But they are right at this point in time by adopting a very cautious approach, because that group of patients were not in the initial studies.
All right. Thank you very much for that. I have a question here. How effective is the doxycycline for after effects of COVID-19 in treatment of coughing bouts? Dr. Sonia, do you want to take this?
Doxycycline isn't recommended as a form of treatment for COVID-19 coughing bouts or the disease itself. It's a antibiotic, and in general is not effective against viruses, only bacteria. But I know that doxycycline is also effective against malaria as a prophylaxis. So at any rate, the fact is there is remdesivir in the United States, which is antiviral and has been tested and has been given approval by our regulatory body, the Food and Drug Administration, to give that medication to people who are infected and have COVID-19 disease. We also give monoclonal antibodies, or these antibodies from people who have recovered. We heard about Sola and, you know, like her, people who had the disease developed antibodies, and those antibodies are pulled together from, you know, people who had the disease, purified and given as, well, that's the plasma piece, but there are different forms. The monoclonal antibodies are synthesized as well, but there are different ways to give the antibodies that are protective, and that's called passive immunity. And those are the major two forms, in addition to the oxygen and other supplemental treatment with IV, you know, fluids and so on if you're in the hospital. Yeah, so any rate, the short of the answer is that we don't give doxycycline for COVID-19 disease in the US.
Okay.
We do have remdesivir and antibody therapy.
I have another question here for you, Dr. Hutchins. And the question is, what sort of things can people do on a daily basis to kill the COVID virus, even if they're not aware that they have been infected with the virus? I suppose it's just something to be doing on a regular basis, whether or not you have COVID.
Right. As a preventive medicine physician, I recommend our pillars of staying healthy and in general, and that should help resist the virus infection. And Dr. Boladeku also mentioned that, you know, he had mild disease because, you know, he, you know, it's healthy, he eats well, and so on. So let me go over those areas that should help you resist resist the virus infection and not have serious illness. The first is diet and nutrition. Now, the American College of Preventive Medicine promotes a whole food, plant-based diet. Now, a lot of people can't be, and people call that being a vegetarian. No meat, period. No, not even fish or seafood in any way. But some of us do practice that, and surprisingly, you stay really, really healthy. Our bodies are not really meant to digest meat. A lot of people don't know that, but that's true. So a whole food plant-based diet is what is recommended. However, it's hard for people who like meat and eat meat to do that overnight. So what we recommend is that a typical plate should have more fruits and vegetables on it than meat. Now, if you add grains, and we're talking about some of the beans and legumes, then 2/3 of your plate should be that. Okay, fruits, vegetables, beans, legumes. All right, so we're talking about a lifestyle kind of change, but you can do it because we all want to survive and stay healthy. The other part is physical activity. We recommend in the US at least 30 minutes for 5 days a week. So that translates into about 150 minutes a week at least of aerobic physical activity to get your heart going, your heart muscle going, getting the blood flowing through your body. Also your lymphatic system, okay? And that lymphatic system is sort of the dumping system for your cells and these antibodies, you know, and you want to clear all that stuff out.
Yeah.
So it's very important. Physical activity is critical.
Thank you very much.
Sleep is critical. Mm-hmm. So we recommend between 7 and 9 hours of sleep. 7 is the least amount, you know, every night. and more than 9 is too much, okay? Then the other piece, which was touched on here, is mental health and emotional well-being. That is critical, critical. You want to manage your stress in your life because that causes a lot of what we call dis-ease or illness, right? So when you think about it and think about the mindfulness activities that you can do, prayer is critical. There's other forms of meditation that people are involved with that it's also helpful. But there's a series of mindfulness kinds of activities to keep you healthy, mentally and emotionally. I have a whole list of them that, that I would recommend, but I know we don't have time for that. But in addition to that, and folks talked about it here as well, is the social connectivity. That's very important. But the way that we're doing that is via, Zoom, computer, Facebook, telephone, not in person. In fact, I have sisters that live in different states from me, and we meet every Sunday via Zoom. And then I have one who likes to be the disc jockey. So she has us sometimes on Saturdays as well, doing line dancing. But that keeps us all connected and informed of how everyone is doing. And that's critical. That's critical during this time. We are human, and we are, we are social beings. And we understand that. But because we're in a pandemic, we choose other ways to stay socially connected that is safe for not only us, but our family and our loved ones. In addition to that, want you to avoid any toxins. Now, cigarette smoking, tobacco is a toxin. And so avoiding cigarette smoking and trying to quit if you do already. So that's very important. In the US, we have a hotline to help people quit. It's helping people move along in their efforts to quit smoking. In the US, it's it's the leading cause of preventable death, tobacco, smoke. And then also the other toxin is excessive alcohol. So cut down on your alcohol use as well, because that compromises the immune system, and you need your immune system during this pandemic. So those are the real key areas to focus on. As a preventive medicine doctor, I prescribe that to my patients all the time and work with them on all those areas as well. And I realize that it's hard to do, but we're going to have to stay, be healthy, because we have this pandemic now, but with climate change, we're going to have more pandemics, and we have to stay healthy and in order to survive them and resist them. And one of the things is to make our immune system strong, and our body strong. And those are lifestyle measures that we all can take to stay healthy.
Right. Thank you very much for that. Somebody just said to me, would you say that having, getting noises in your ear is actually a symptom of COVID-19? Would you say that? Tinnitus? Oh, is it tinnitus? Yeah.
I mean, you could. There are viral infections that, get into your inner ear and cause problems as well. That's not one of the commonly reported symptoms, but it's possible. So
symptoms actually do differ from person to person. That's what I'm trying to get across.
It could. I mean, the symptoms can, but but there are some common symptoms that most people have.
Right. Okay. Thank you very much for that. Excuse me, Dr. Hutchins, AK. Somebody just posted something here. Hi, for me, I had Pfizer jab yesterday and found out that that's not enough information given regarding allergy reactions. I was asked if I have allergy reaction to drugs and injection in the past. Of course, I said no. I was given a piece of paper to read and said yes or no to the questions. The questions were drug and medication related, which I didn't understand and will take a medical person to explain before you can say yes or no to any allergy reaction. So I think before one is given the jab, a bit of explanation is necessary in knowing whether to say yes or no to those questions. I think is a way of going back to your GP and finding out more in order to make an informed decision as to whether or not to take the vaccine. Would you agree with that, Dr. John Bolodioku? Yes or no?
Yeah, I mean, yes, I totally agree with that. I mean, I think actually what everybody must appreciate is that the GP they should explain to you about the vaccine, about what the side effects would probably happen, the anaphylactic reaction that could happen, and they would take a history. Those are all things that should be done appropriately before you actually succumb to the vaccination. And if you don't understand it, it's your right to ask for them to explain. No one's going to force you. You just make sure you understand and you know what you're signing. So please, if you don't understand, please ask again. There is no idiot here. You know, we are all trying to help each other. Just ask again.
Okay, thank you so much for that. So let's quickly go into the morph round. That's myth or fact. Is either yes or no. The first statement here is the vaccine is not adjusted for any country. Dr. Bolodioku, yes or no?
No.
No. Okay. COVID is a disease. Dr. Hutchins, AK.
Yes.
Okay. COVID is a condition. Dr. Mabiola.
The disease. No.
It's a disease. Dr. Bolodioku, is it a condition or a disease?
It's a disease.
Disease.
Now we're right. Okay. It is a taboo to have COVID.
No.
No.
No, because this is one of the problems that we have in Africa, especially in Nigeria. No, it's not my portion. I don't have COVID. Even though you are aware that the person has actually been into isolation center, they've probably spent about 2-3 weeks, but they come out to say, no, nothing happened to me. Thank God it was malaria. Now, the next statement is COVID only affects Caucasians. Dr. Sonia.
No.
No.
Okay. COVID only affects people living in cold climate. Dr. Bolodioku.
No.
Okay. COVID can be transmitted by touching. Dr. Shenu.
By touching, well, yes. Somebody touches you and you touch your nose, yes.
Okay. COVID can exacerbate pre-existing health condition. Dr. Sonia.
Yes.
Okay. COVID only affects the elderly. Venerable Tunde Roberts, from what you've heard today, COVID affects the elderly. Yes or no?
It affects the elderly and everyone.
Good. COVID is a spiritual attack and prayer is the solution. Venerable Tunde Roberts.
Prayer alone is not the solution. You need to get the vaccine.
Okay, right. COVID only affects those working in the healthcare sector. I'll do that to Shola Doyle.
No.
Okay. People in Africa are not affected by COVID. Dolapo. Yes or no?
It affects, it's a world pandemic, everyone. Nobody's exempted.
When you tell people that pandemic means something global, they still say no. Don't bring COVID to Africa. So it amazes me, and these are educated people. People in Africa are not affected by COVID. We've already gone through that. COVID safety protocols include protecting yourself and others.
Yes.
Yes.
Okay. Now,
Yes.
COVID symptoms are the same for everyone. Fred, yes or no?
I beg your pardon?
COVID symptoms are the same for everyone.
No. No, it differs from individuals.
Okay,
But
fantastic.
there's a common set of symptoms that are mainly common, just like Dr. Hutchinson said.
But it differs. Okay.
Yes.
Right. When you suspect you have COVID, self-isolate to protect others from being infected. I just want to throw it to I think I can see Mrs. Janet Akimboni there. So when you suspect you have COVID, self-isolate to protect others from being infected. Yes or no?
She said yes.
She said yes. Okay. Okay, she said yes. All right. You build resistance after you've been cleared of COVID.
Can you repeat that, please?
Dr. Shenu, you build resistance after you've been cleared of COVID or after you've been treated.
I think the answer is you get immunity. You don't build resistance. You build resistance by doing all the things Dr. Hutchins said about keeping your health right. So you get immunity, and that is it.
You agree with that, Dr. Hutchins, okay?
I did. I like his answer. Absolutely.
Oh, you love his answer. Okay, fantastic. You know immediately when you have COVID, Dr. Toyin.
No, you don't.
Okay. COVID virus enters the body through MEN. I don't want to say that so that I don't get accused of being sexist. Mouth, eyes, and nose. Yes or no? Venerable Tunde Roberts.
Mouth, nose,
And
I'm
nose.
not sure of eyes.
Okay, Dr. Bolodioku. COVID virus enters the body through MEN. Mouth, eyes, and nose.
Well, it will go through any mucosal surface, and the eyes will be a mucosal surface. So yes, it will go into your body.
Okay. Now, every member of my household, including domestic staff, that is the driver, the cook, the chef, the cleaner, must be careful about COVID-19. Yes or no, Fred?
Yes.
Yes.
And just to add to that, I've seen in Nigeria where they force the house help and to vaccinate, but the bosses don't to protect themselves. But the bosses said, "Oh, I'm okay," and he doesn't protect them as well.
Okay.
I was also going to mention.
I just have one or two for you. Hold on a second. Asymptomatic persons know they have COVID.
No, they don't.
They don't. Whilst you're there, to build immunity, medicines to have at home include vitamin C, zinc, paracetamol, and vitamin D. Yes or no?
Perfect.
Yes.
Yes.
Hey, staying in the air-conditioned environment. You know the reason why I'm holding you on, because I want you to give us a final message. Staying in air-conditioned environment aids the circulation of COVID. Dolapo. Yes or no?
Yes.
No, you need to open your hair, the windows. You need to, I can't sleep with the windows closed.
So staying in air-conditioned environment aids the circulation of COVID. Yes.
Yes.
Yes. Yes.
Right. Now, severity and duration of symptoms for people who have COVID can vary. Dr. Hutchins, okay, fantastic. When COVID symptoms are severe, you only require hospitalization. Fred?
Yes. When you find out that you can no longer breathe, yes, you will need hospitalization.
Okay. Is that right, Dr. Bolodioku?
Yes.
Yes.
Okay. Self or home-based isolation means not going to public places such as workplace, school, market, churches, meetings, and parties. Dr. Shenu?
Yeah. Yes.
Okay.
We're all in isolation anyway.
Okay.
Lockdown.
Home-based isolation does not preclude me from meeting my family members who live near me. Yes or no?
It does.
It does.
It does.
Okay. COVID vaccination is a method of depopulating Black people. Dr. Sonia?
Yeah.
No.
It may be. Yeah. It's a way of depopulating the entire world.
So, COVID vaccination prevents you from getting COVID. Is that right, Dr. Bolodioku?
So COVID vaccination prevents you from getting COVID.
No.
No, it doesn't.
It prevents you from getting ill.
Okay.
Yes. Thank you. That's the key point.
That's the key point. So thank you so much for the, hold on a second, Dr. Bola, like a little boy. We're going to round up right now. So thank you so much. We've talked about the fatality of COVID-19. Hopefully we've informed people that it is actually a serious disease, you know, and we need to take care of each other. I take care of myself, meaning I take care of everybody else around me. We need to actually keep the 2 meter social distancing, or I call it physical distancing. We need to wear a face mask. We also need to wash our hands regularly and use a sanitizer, just to be careful. And another thing, we've talked about the vaccination. Hopefully with what people have heard today, we've managed up to a reasonable level to convince people that we need to be vaccinated. However, if people still require more information, they should go to their doctors, the family physician, or the GP, as we say here in the United Kingdom. Be informed. Be informed is very important. Even if we're spiritual, we should still apply wisdom. So I'd like to thank everybody for joining. I'd like to thank Venerable Tunde Roberts. I'd like to thank Dr. John Bolo Deoku and Dr. Sonia Hutchins, who came in at the very last minute. Very, very grateful to have you on the platform. Thank you, Dr. Toyin Magbagbiola Dolapo Oguleye, for sharing with us. Shola Dol, I thank you. I thank you, Fred Adegeye, and I also thank you, Dr. Shani Hudein. Thank you so much for your contributions. But before we go, there's just a poll. I just want to, especially for the people who are not on the panel, to please answer the questions. It's just a quick poll. This gives us an indication whether we've addressed the issue of the topic of the day, and also is a way of improving subsequent discussion programs. So Dr. Bolodioku, as soon as you finish completing the poll, you can exit the platform. I'd like to say thank you to everybody. And also for people who are actually watching from YouTube. So here's the poll. Thank you. And please note, your answers are anonymous, so I wouldn't be able to tell who is who, you know, how you've rated anybody in terms of the moderator or the panel. Just feel free to answer the questions that's part of the poll. Thank you.